You brush twice a day, you floss, and you use an antiseptic mouthwash every single morning. Yet your dentist still says your gums are bleeding. What if I told you that nuking your mouth with alcohol-based mouthwash is the exact reason your gums won't heal? Today, we are exposing. This video is for educational purposes only. Advanced periodontal disease can lead to irreversible bone loss and severe systemic infections. Natural remedies are meant to support the oral microbiome, not replace essential dental care. Always work with a qualified biological or holistic dentist for a comprehensive evaluation. First, I want to honor your effort. If you are here, you are not lazy, careless, or bad at oral hygiene. You're probably one of the most disciplined people in the room. You brush. You floss. You try to do everything the commercials told you to do. And yet the bleeding keeps coming back, the breath keeps coming back, and the frustration keeps building. That frustration is real. The problem is that modern dentistry and marketing taught most people to think of the mouth as a battlefield. Kill the germs. Burn the germs. Wipe everything out. But the mouth is not a sterile sink drain. It is a living ecosystem, a dense microbial community where some organisms are protective, some are neutral, and some become dangerous only when the balance is broken. That idea is at the center of the ecological plaque hypothesis. Oral disease is often driven by dysbiosis, meaning a disturbed microbial environment, not simply the presence of bad bacteria alone. That is why the stronger is better mouthwash mindset can backfire. Antiseptic rinses do not politely remove only the troublemakers. They can also suppress the protective organisms that help keep the system stable. In one study of daily alcohol-based mouthwash use, researchers found an increase in certain opportunistic bacteria linked with periodontal disease and a decrease in actinobacteria, a group associated with blood pressure regulation. But the authors also cautioned that the sample was small and more research is needed. So the question is not, how do we sterilize the mouth? The real question is, how do we restore biological balance so the gums can calm down? Because when the ecosystem becomes too stripped down, the mouth becomes less resilient, more reactive, and easier for inflammation to take over. That is why so many people feel trapped in a cycle of rinse, burn, temporary freshness, then relapse. And here is the part most people never hear. Your oral bacteria are not just about breath and plaque. They are part of a larger biological conversation happening throughout the body. The mouth is the gateway to that conversation, and when you keep blasting it with unnecessary antiseptic force, you may be disturbing far more than you realize. In the next chapter, we are going to open up the nitric oxide story, because this is where the mouth and body connection gets truly shocking. That phrase sounds dramatic, but it is exactly how many people experience the effect of chronic chemical overkill in the mouth. Everything gets wiped out, and then the balance is gone. The modern understanding of gum disease is not that the mouth is simply dirty, or that one villain species secretly does everything. It is that periodontal disease emerges when a complex community of microbes and the host environment fall out of balance, a state called dysbiosis. The mouth is an ecosystem, and the ecosystem is what has gone wrong. In the oral cavity, there are hundreds of microbial species interacting with one another and with your immune system every single day. Some microbes help maintain stability, some are neutral, and some become harmful when the environment shifts. That is why the old, kill all germs mindset is so incomplete. A healthy mouth is not sterile. A healthy mouth is balanced. Here is where antiseptic mouthwash becomes a problem. Chlorhexidine, the classic prescription antiseptic, has been shown to cause a major shift in the salivary microbiome, including lower diversity and a move toward more acidic conditions. In controlled studies, It also suppresses nitrate-reducing oral bacteria, the same organisms your body relies on for a key nitric oxide pathway. So the issue is not just that you are killing germs. The issue is that you may be stripping away the very species that help the mouth stay stable and biologically intelligent. And once that balance is disrupted, the mouth becomes easier for inflammatory organisms to dominate. That is the essence of dysbiosis. Not a single germ attack, but a microbial environment that has been pushed out of harmony. In that state, the gums can stay irritated, plaque can become more pathogenic, and the whole system can keep feeding its own inflammation loop. The mouth stops acting like a cooperative ecosystem and starts acting like a stressed one. This is why so many people feel confused. They're doing the disciplined thing, yet the mouth never fully settles down. From the outside, it looks like they are being religious about hygiene. Biologically, though, they may be living in a cycle of over-disinfection, loss of microbial diversity, and recurring inflammatory rebound. That cycle is not a personal failure. It is a sign that the strategy itself may be wrong. So when I say nuclear bomb, I am not saying your mouthwash is evil. I am saying the philosophy is outdated. If your mouth keeps bleeding, keeps smelling, and keeps relapsing, the answer is not necessarily more punishment. The answer may be restoration. Preserve the helpful species, reduce the ecological stress, and let the oral environment recover its own defenses. That is the biological pivot most people never get taught. This is where the story gets bigger than teeth. Your mouth is not isolated from the rest of your body. It is part of a nitric oxide pathway that begins with dietary nitrates from vegetables, is processed by nitrate-reducing oral bacteria, and helps support normal vascular signaling in the body. In other words, some of the bacteria living in your mouth are not there to hurt you. They are there to help chemistry happen. The most important thing to understand is this. The bacteria on the tongue and in the saliva are not just mouth germs. They are functional partners in a biological pathway your body depends on. When that oral ecology is healthy, nitrate can be converted into nitrite more efficiently, and that supports the downstream nitric oxide system. That is why the mouth is not just about breath or plaque, it is part of cardiovascular biology. Now here is the shocker. Antibacterial mouthwash does not always just freshen the mouth. In controlled studies, antiseptic rinses have been shown to suppress nitrate-reducing oral bacteria. One review reported that a 0.12% chlorhexidine mouthwash destroyed up to 94% of nitrate-reducing oral bacteria and reduced nitrate by 85%. That is not a minor cosmetic effect. That is a biochemical interruption. And the body notices. In a randomized crossover trial in treated hypertensive adults, 3 days of antibacterial mouthwash lowered oral nitrate to nitrite conversion and was associated with a 2.3 mm of mercury rise in systolic blood pressure compared with control. Other studies found the blood pressure effect could appear within 1 day and persist across the intervention period. That does not mean mouthwash is the only factor in blood pressure. It does mean the oral microbiome is part of the conversation. So the real question is not, how do we make the mouth feel the most sterile? The real question is, what is the biological cost of repeatedly stripping away the very bacteria that help generate nitric oxide? That is the hidden trade-off most people never hear. You may get a temporary burn, a minty blast, and a clean sensation. But you may also be disrupting a pathway that helps support normal vascular function. So when I say the mouth is the gateway to the body, I mean it literally. If you keep suppressing the microbes that convert nitrates into nitrites, you are not just changing the smell of your breath. You are altering a system that connects oral ecology to circulation. And that is why the next step is not more chemical warfare. The next step is restoration. This is the turn most people never get told about. If periodontal disease is a breakdown in the ecological balance of the mouth, then healing is not just about attacking harder. It is about restoring order. And that starts with one uncomfortable truth. If you keep wiping out the oral ecosystem every day with antiseptic overkill, the terrain never gets a chance to stabilize. Periodontal disease can progress from bleeding gums into damage of the gums and bone that support the teeth, which is why restoration has to be taken seriously. So here is the biological shift. Stop thinking in terms of sterilize, sterilize, sterilize. Start thinking in terms of reseed, support, stabilize. Professional cleaning matters, because hardened tartar cannot be removed by brushing and flossing alone. But once the mechanical cleanup is done, the long game is ecosystem repair, less chemical warfare, more microbial balance. Do not ignore advanced bone loss. See a biological dentist or periodontist for a full evaluation. That is not a throwaway line. It matters because if bone and attachment are already compromised, you do not want to guess your way through a serious condition. The best oral microbiome strategy in the world is an adjunct, not a replacement for proper diagnosis, periodontal therapy, and professional follow-up when the supporting tissues are already involved. Now, this is where a premium oral probiotic protocol enters the picture. The evidence is not magic, and it is not universal, but it is promising. Recent reviews suggest probiotics may be useful as an adjunct to non-surgical periodontal therapy, especially some Lactobacillus reuteri approaches, while also making clear that results are mixed and strain-specific. In other words, this is not a miracle pill. It is a biological support tool that may help tip the environment back toward resilience. And that idea makes biological sense. NIDCR has noted that disruption in the balance of oral microbes can contribute to periodontal disease, and that increasing lactobacillus levels in the oral microbiota may be a useful approach for combating oral fungal disease in certain settings. That is the deeper recovery mindset. Not just less bad stuff, but more of the right biology. So whether a person uses a clinician-guided oral probiotic lozenge or another premium oral microbiome support plan, the principle is the same. You are trying to help repopulate the mouth with organisms that support balance, not strip everything away and hope for the best. That is the recovery protocol. Restore the terrain. Support the ecosystem. Then let your natural defenses do what they were designed to do. Your mouth is the gateway to your entire body. Stop nuking your ecosystem, start cultivating it, and let your natural defenses heal your gums. That is the real shift. Not fear. Not punishment. Not more burning chemicals. The goal is biological harmony. A mouth that is stable enough to defend itself again. Oral disease is not just a cosmetic issue. Periodontal disease can start with swollen, red, bleeding gums and, if left untreated, can progress to destruction of the tissues and bone that support the teeth. And that is why the old, kill everything, model has to be retired. A healthy mouth is not sterile. It is balanced. When the balance is disrupted, the problem is not only what has been added, it is also what has been lost. Restoring oral ecology means protecting the helpful organisms, supporting the terrain, and reducing unnecessary chemical stress so the system can recover its own rhythm. That is also why a premium oral probiotic protocol can make sense as a supportive tool. The best recent review data show probiotics as an adjunct to periodontitis care, with mixed results overall and possible benefit in some severe cases. Which means the smartest way to talk about them is as support, not as a miracle. The promise is not that probiotics replace dental treatment. The promise is that they may help repopulate the mouth with a more favorable ecosystem after the terrain has been cleaned and stabilized. So if you have been doing everything right, and still feel stuck, hear this clearly. You are not broken. Your mouth may simply be living in the wrong environment. Once the environment changes, the gums often change with it. That is the biological lens. That is the recovery lens. That is the future of oral health. And yes, there is still responsibility here. If you have advanced bone loss, loose teeth, pain, or persistent deep bleeding, you do not delay. You need a qualified biological dentist or periodontist to evaluate the tissues, the bone, and the underlying infection risk. Natural support is not a substitute for professional care when the disease has already progressed. Check the link in the description for the premium oral microbiome support blueprint. And remember what matters most: do not chase the feeling of sterilization. Chase the biology of resilience. The mouth heals best when the ecosystem is respected, not bullied. This video is for educational purposes only and is not a diagnosis or treatment plan. Advanced periodontal disease can cause irreversible damage, including loss of gum support and bone, so anyone with persistent bleeding, pain, or loose teeth should seek evaluation from a qualified dental professional. Probiotics and microbiome support are adjuncts, not replacements for essential dental care.